A Democratic mayor and a Republican Speaker of the House come together to try to solve the state's auto insurance woes. But does bipartisanship lead to success? And Detroit moves back to the top of a list no one wants to lead. Do the numbers tell the story on crime? Today is Sunday, October 1st, 2017, and this is Flashpoint. Hi, welcome to Flashpoint. It is the first day of October, so fall is undoubtedly here. But the rites of fall have taken a wild turn this football season. I am still stunned that with the island of Puerto Rico in full post-hurricane freefall, an absolute catastrophe, with nuclear confrontation feeling way too close for comfort in North Korea, and with enormous debates over American health care and our tax system, with all of that, we're spending a lot of time debating national anthem protocol. I guess it's debating. I'm not sure either side is actually listening to the other. But then again, you could say that about so many issues on our national table right now. You know, it all started with Colin Kaepernick. It was about police brutality, but it seems to be about so many more things now. This morning, we're going to sit down with the Detroit Police Chief, James Craig. We're going to talk about the new violent crime statistics that, again, have Detroit perched at the top of the wrong list. He takes some issue with the way those figures are tallied. We'll ask him about what the new figures say about the city's comeback. But up first, we're going to dig into the plan from Mayor Duggan and House Speaker Tom Leonard that seeks to revolutionize our state's no-fault auto insurance system. Surely anything that brings down the price of the nation's most expensive car insurance would be welcome, right? Well, not so fast. It's this morning on Flashpoint. It is up near the very top of the list of frustrations to living in Michigan, the high cost of auto insurance, the highest in the country. And if you live in Detroit, it's even more obscene. Let's talk about the new proposal from the mayor of Detroit and the Speaker of the Michigan House to reform no-fault insurance. Is it the right way forward, or does it actually take us backward? My guest this morning, State Representative Jason Shepard from Monroe County, here with us. Thanks very much for being here. Butch Hollowell, Corporation Counsel for the City of Detroit. They both think this is solid legislation. On the other side of the table, on the other side of the issue, State Representative Sherry Gay Danyogo from Detroit, and the Oakland County Executive L. Brooks Patterson. It's interesting. I have two Republicans and two Democrats at the table, and yet you're split along different lines than we might expect. Butch, let me start with you, though, sure, and why you believe that this is finally the way to move forward.
No-fault system is broken because consumers don't have choices and the costs have spiraled out of control. Now Michigan ranks #1, again in the wrong category, as being the most expensive state in the nation. And going along with that, we also have the highest rate of uninsured drivers in the United States. We're higher than Florida, that has hurricanes. And so what we're proposing is to give drivers choice. You can keep the unlimited benefits that you want, which really does drive up the rates, or you can have a policy that fits your needs of your family at $500,000 or $250,000. And we end the loophole, finally, that prevents seniors from using their Medicare. They've been prohibited from using that, and that'll cut rates from 20 to 50%, but for seniors, they could see 50%.
Representative Shepard, I think that a lot of people would say that clearly with the highest we have, it's the most expensive, but I think the argument you're going to hear later is that it's the most expensive because it's the best, and that we shouldn't give that away.
Well, I've heard that argument. I live 1 mile north of the Ohio border, where in the state of Ohio, insurance rates are a third. Obviously, they have a completely different system when it comes to how they administer their auto insurance. But I say that to say that in these other states that are also no-fault states, you see that people are getting care for after accidents in these other states. And they have provisions in there to cap, so it's not an unlimited benefit with unlimited checkbooks without any parameters. And that's what hurts the ratepayers here in the state of Michigan.
Brooks Patterson, I'm not sure where you would have been on this argument several years ago, but given what you've been through, having been in a very serious accident, and I think as you told our news coverage this past week on this, it's very easy to suddenly run through $500,000 when you're talking about post-care. It is, I think that your own life experience is informing where you are today.
Well, yeah, and I joined the No Forces before my accident, about a year before. A gentleman came out with his quadriplegic daughter, and we talked, and she was explaining to me why the insurance is different between her being in bed now. She's in a wheelchair, actually has some mobility. So I joined them. Then I had my accident. I'm not on any of the insurance that they're talking about. I'm on workers' comp because I was on duty when I got hit. My driver hit the roof, broke his neck in 3 places. He's a quadriplegic. He went through $500,000 the first 2 weeks. So if you're going to put a cap like that, it's illusory at best. This is for catastrophic. This isn't for fender benders. This is for catastrophic accidents. You're going to be seriously injured, and the costs of the emergency room today
it goes fast.
Yeah, and I think Butch, and I've known Butch a long time, I respect him, rather than pick on the law, I mean, not pick on the insurance companies.
Right.
They redline in the city of Detroit. They use test scores. They use your
it's funny.
zip code.
It's funny you say that, Brooks. It's really not, because the fastest rate of increase is in Oakland and Macomb and Kent counties. So we looked at the lawsuits that are over the last 10 years.
We're talking about people who are paying $5,000, $6,000, $7,000 on a vehicle.
The rate of increase is fastest in Oakland, Macomb, and Kent counties. And what we're saying is, get those under control. Lawyers now own the X-ray facilities. There's a kickback to the hospitals of 5 times the Medicaid rate. That's why the costs are out of control.
Let me let Representative Danyogo get in here, because I think some people would be shocked that you would be against anything that would bring the cost down because of the specificity of the Detroit problem. It's insane what people pay for car insurance in the city of Detroit.
Well, certainly, I'm always on the side of our consumers. And so this package, what they call choice, is trickery at best, because it provides a backdoor for insurance companies to hike the rates up based on these non-driving factors that Mr. Brooks has pointed out. If you don't remove their ability to charge rates based on zip code, territorial rating, which is in statute, we have to address that. So women are paying more. Widowed women are paying even more. It's unfair. No one should pay rates based on their education attainment level, where they live. If we're going to make the system fair, we can address fraud with a fraud authority that goes both ways, because we have insurance companies that drive rates up on litigation because they won't pay when they're supposed to.
I think I'm right on this. Michigan is the only state out of the 50 that does not regulate the insurance industry. They're unregulated.
Well, actually, we do. You have a file in use for any proposed increases. But what I'm saying is, the reason this doesn't make sense is, at the end of the day, we have baked in a monopoly for the trial lawyers that actually own the X-ray facilities and the imaging facilities, unlike any other place in the country.
Lawsuits right now.
And here's something else I want to add to that. So what was mentioned earlier from your personal experience, Brooks, and I've heard that. I would challenge this portion of it, though. You received care based upon workman's comp, and I feel, and if you feel that the care there has worked for you, your driver received care under auto insurance. I would say this: is it fair to the consumers that if you're in an automobile, your insurance is different, a better care, than if you're out of an automobile for the same injuries? That is something that is a definite thing to look at when it comes to this. I think that this plan in and of itself allows for that opportunity for your private insurance, your Medicare, if you're on that, especially for the seniors, and others to step in if it gets above that certain level. And really, about 1% to 2% of auto accidents even reach the catastrophic claim level. So these caps, the average auto accident's about 50,000. And that's what you see across the country in no fault, is the majority of the cap are at that 50,000 and under for medical when it comes to your auto insurance.
What's really interesting about this debate, it ends up being a debate about health care as much as it does about insurance.
Well, people don't realize also, with the coverage that we have now, we have children that are uninsured, maybe perhaps by their children, by their parents. And so our insurance coverage provides that care in the event that children are in an accident as well. But what we have to look at the impact that this would have on our level 1 trauma hospitals, but you should know something about that, the jobs and how that they would be impacted. But the most attractive component that I saw in the choice package is the senior component. So let's talk about that. But you know what I find strange? As the only Detroiter serving on the insurance committee, I find it interesting that we didn't work together on developing a plan that would be specific to addressing the concerns in Detroit, in fact, yet call it a civil rights issue.
And I was going to ask that. After all of the years and years of complaints about redlining in Detroit, which I'm not sure anybody even argues anymore,
they don't.
Why haven't we addressed, why is that not specifically addressed?
That's not the issue. anymore.
How is it not?
The issue is that all Michiganians are paying more. Detroiters are paying more than anybody else at $3,400 a year, but the average Michigan driver is paying $2,400 a year. And let me tell you why. For an MRI, as Brooks was saying, for an MRI right now under Medicare, if you're not in a car, it is $484.
Right.
Under no fault, that same procedure costs $3,800. That is the redlining. And redlined by lawyers.
I think it's disingenuous to call this issue a civil rights issue and not address. When you wore the NAACP hat, it was totally different.
Right. It is
so
still
now
a civil rights issue.
It's not a civil rights issue.
It is a civil rights issue.
But how so?
It's a civil rights issue by making sure it's fair to all Michiganders.
But it's fair if you don't take those factors away.
All Michiganders.
Let me let Representative Shepard get in.
So I'm going to step back from a civil rights issue. I'm going to go back to what you mentioned about level 1 trauma centers. If you go across our country, we see that there's hospital growth everywhere. We're the only state that has the unlimited coverage and this much medical in there. I don't see a lack of that. The other thing I would also argue, since we are the only state that doesn't have medical coverage with our auto if we use our own health insurance, do we have the lowest health insurance rates in the country? We do not. We do not. Why is that? When every other state, their health insurance does cover if there's an auto accident, we don't. We don't have the lowest rates in the country. There's a fundamental problem that we have to fix. And there's certain structural dynamics to this plan and to the way that we administer our auto insurance that we have to look forward and fix. And to cover one other issue, a part of the new package does exclude marital status and whether you're male or female from being part of the debate for the rates.
What grade they were retained in school? What's their credit? Things that had nothing to do with driving skills, and yet are factored in setting the rates in Detroit. That's redlining. And it's going on.
We've scored it, and that is not going to solve the high rates. In fact, we scored it, and it's not going to save that much money. This package saves almost 50% by saying that you can't double check.
It puts them at risk.
95%.
$500,000. We'll go through that in a couple of weeks.
Brooks, 95% of Michiganians have health insurance already. No fault makes you buy it twice.
Well, we talk about percentages. How about this one? 1992, question on the ballot to repeal and throw no fault. Take it away. 66% of the state said leave it alone. 94, they come back with a cap. I think it was $1 million. 63% said leave it alone. So when you go to the public, they seem satisfied with the system we have. They tell the legislature, leave your hands off. So what do you guys do?
Well, not my public. I will tell you that.
People are walking with their feet.
I'll tell you, 66% is two-thirds of the state.
In Monroe County, it is an 80+% margin for something to change. And as far as the rates go, as far as blowing through the 500 or the 250 or however it is, let's recap that there is actually a fee structure included in this plan. So currently, you can raise $500,000 pretty quickly if the cost of an MRI or the cost of a procedure is 5, 10, 15 times what it would cost if there was a fee structure in place. So you're getting the same service at a much lower percentage based upon a fee structure set up ahead of time. And that's what's
You're in the legislature. When the public says leave it alone, why do you guys do it and run behind them?
My public doesn't say that.
So I don't disagree that we don't have to have all stakeholders at the table, but to allow a backdoor for insurance companies to continue raking in money with no transparency without addressing the factors that put urban communities at risk for higher rates is unfair. If you don't remove those zip code or territorial factors, because it's in statute that they continue charging us more, they can also stress that there's a hardship in hike the rates up.
There's always an excuse, but now we've actually got a bill, and this bill will save consumers 30 to 50% by allowing them to have choice for the first time in Michigan and have affordable policy.
They had a choice.
And not have to choose between paying your premium and your groceries. That's
absolutely not true.
I knew we would solve it. It's 20 minutes.
Majority leader said Leonard is wrong.
I apologize. Thank you all very much for being here. We come back, Chief James Craig, to talk about these new crime statistics.
Craig, will you yield to us, Chief?
All right, welcome back. Detroit again finds itself labeled America's most violent city thanks to new crime data released by the FBI. Police Chief James Craig takes issue with those figures and the way that they're put together, and he's back with us again this morning on Flashpoint. Chief, thanks very much for coming. I'm good.
Glad to be here.
Before we get into why these figures are wrong, I think some people will say this is really interesting the way that you want to split hairs, because whether you're number one, I'm not sure I'd feel much better if we're number 10. This is all just sort of rearranging deck chairs on a sinking ship that it really doesn't matter where we are. It's too violent, there's too much crime.
Well, you know, I've oftentimes said we're not going to wave a flag of success. Let's just look at the crime of homicide. So, you know, we may hit 290 this year. You know, as I reported out, 300 homicides, too many, but yet a 45-year low for homicides. So, but we're talking about data in violent crime like aggravated assaults. 2015, we went with the FBI, Michigan State, and we said, look, you are underreporting our aggravated assaults. You know,
underreporting.
I mean, in 2015, it was 2,000 fewer aggravated assaults. This year, they're reporting 1,000 more. Bad data coming out of an old, antiquated system.
So you think the bad data has worked both ways?
It's worked both ways, but then if you underreport last year, and the statisticians will understand this, you underreport in 2015, then you overreport in 2016.
The net looks horrible.
Well, they came out with this, well, our violent crime was an increase of 15%. I say wrong. We were down 5% against data that we scrubbed. And we did it the right way.
You're very aggressive about this set of numbers. You've been, you've talked to the Washington Post. You're going to Washington. You've talked to the FBI. You've talked to the Michigan State Police. You're not kind of taking this sitting down. But I guess to the layman, why is this so difficult to figure out? It should be it's simple math. We know how many people were killed. We know how many people.
Well, the homicide numbers are easy. Those are not in dispute. You know, when you talk about like this new system we purchased to rectify the problem, it cost the city $9.1 million. We launched it December of last year. So we know that this system is accurate. Why? Because at the end of July, we had 7,000 aggravated assaults. 7,000. Of that number, 17 reports were in error. 17. So it has less than 1% error rate, which is what we want. The problem in the old system, it didn't talk to the states or the FBI system.
But if I'm a Mac person and the person that my boss that I have to answer to, in this case the FBI, is using Windows, I mean, how do we get those things together?
Well, as you remember, when I arrived here 4.5 years ago, we were facing bankruptcy. I knew coming in the door that that was not the system. Ella Bully Cummings, who was chiefs ago, when the system was purchased, she knew it was a bad system. She says it. So my point is, so we bring in a doctor from Wayne State because credibility is important. I knew that this doctor, Dr. Martin, was credible, respected, and so we bring him in so there could be a seamless translation of the crime data. The problem is we couldn't fix the system, so we ended up buying a new system. Which
now complicates things as you try and marry it with somebody else's data. But I guess at the end of the day, as the phrase is so often thrown around, at the end of the day, are you saying that you believe that Detroit's data is uniquely wrong, or do you imagine the FBI is getting data from cities all over the country? Are all of our crime statistics skewed and unreliable?
I believe so. I believe so. I'm just going to speak for Detroit. I'm telling you, first of all, it takes 10 months to publish a report on computer data that at the beginning of the year, you know, Devin, the first week of January, we are reporting out on our crime stats. Beginning of the year. We track these things daily. This is not just in every 6 months. Every day we know where we are with crime.
It is weird because, of course, yes, every day in this newsroom we're reporting on real-time data, and yet the statistics always come out.
Takes 9 or 10 months.
That's
and we're talking about 2016. we are confident. I stand behind our numbers. We're 5% down, and as you indicated early on, so what's the difference in being 1, 2, or 3? Well, we get the crime picture. But what's most important to me is the perception. You know, are we making a difference together? I would say to you, yes. I talked to many residents, people who live, work, and play in the city of Detroit. They have seen a difference in violence. And so when LA had 2,000 murders a year, I remember, 2,000 murders a year. And when LA started to turn the corner, it didn't happen overnight.
Yeah.
Is Detroit turning the corner? Absolutely.
The other, and counter to me saying earlier that it doesn't necessarily matter, the counter argument would be at a time that we're trying to attract business, at a time that we're trying to make a bid for Amazon, being having the stats wrong or being at the wrong place on that list can be a very expensive.
It does matter, but you know who else it matters to? It matters to the men and women who wear the uniform, who serve with distinction and honor, who are fighting the good fight to try to make this a safer city. So if it's a percentage point, if it's 100 crimes or 2,000 crimes, it matters to me and it matters to this police department.
So where your sense, you mentioned earlier the murder rate, overall, if things don't change dramatically, something crazy doesn't happen between now and the end of the year, where do you expect that we are when it comes to trends on violent crime?
Well, we will be down. That's what I'm hopeful. We're now in our fourth quarter. You know, we may end the year at the rate we're going. If we end the year with 290, 285 homicides, that would be the lowest number in 45 years. There was a time in Detroit where murders were up 800, 900.
That's also against a larger population.
Larger population. And so that does work against us. Yeah. But then, you know, there are other factors that people generally don't talk about. Let's talk about the poverty rate. And while the city is making a great turnaround, we still have one of the highest poverty rates.
Yeah.
Let's talk about education. Let's talk about individuals suffering from mental illness. There's a correlation between poverty and mental illness. And I know for a fact that our SRT is deployed more often now dealing with people or individuals suffering from mental illness.
You and I've talked about this before. I so often wonder every time we talk about any crime how often it's really connected to somebody's mental illness or a substance abuse problem.
You know, unfortunately it is, but we need to fix it. It's a public crisis. You know, this Band-Aid approach, and this is not a criticism just on Detroit, this is a national issue. Going in for a 72-hour hold does not work, particularly if people need sustained treatment. So what we've done is we've criminalized those suffering, because if you talk to Benny Napoleon, the sheriff, you know what he'll tell you? 80% of his inmate population is suffering from mental illness.
It's become a problem. Mental health system, exactly. Chief, thank you very much.
Thank you so much.
Always appreciate talking to you. Right. We'll wrap things up right after this for Flashpoint. That's great.
Thank you.
That's going to do it for us this morning. Quick note about next week's Flashpoint. We will continue our conversations about what it will take for Detroit to attract Amazon for its enormous HQ2. John Gallagher will be here to talk about that. In the meantime, Meet the Press coming up next right after Mitch Albom's Heart of Detroit. Have a great week. We'll see you next time right back here for Flashpoint.
11-year-old Jeronica Crenshaw grew up hearing from her parents what it means to help others, but it's her own compassion that sets her apart from her peers.
I noticed a lot of kids like to play on their phones these days and not worry about cleaning and helping others. But I like to help other people because you never know what somebody's going through, so it's just a good thing to help people.
It's a simple concept, but one that's made a huge impact in her community.
Do you sort of wake up each day and look around the neighborhood and say, what can I do to help?
Yes. Like a lady around the corner from me, I like to mow her lawn because she can't walk. So she's in a wheelchair, so I just like to help her.
When was the first lawn that you mowed?
Mine.
How old were you then?
Probably like 8.
Was it hard to push a lawnmower when you were 8?
Yes.
Or was the lawnmower pushing you?
Pulling me.
Jeronica does each project with a smile, including her Change for Change program to build a neighborhood park.
The parks we have are schools, and we would like to just have a regular neighborhood park with maybe a sit and spin, a swing, and just like a sandbox, little things just for the kids to have fun.
Her message for change is infectious, and her love for her neighborhood is unmistakable.
What's special about being in a neighborhood?
Knowing people can count on you to do things that they might not be able to do, it makes me feel good about myself.
Jeronica Crenshaw is proving that with hard work and positive thinking, change is possible right here in the heart of Detroit.